So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
And what we're trying to do is replicate what you would have, for example, in my office. You want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as in the studio audience. That's the essence of what we want to do. Welcome, and thank you for that applause. I appreciate it. Thank you very much. Now, today we're talking about sun safety, a critical topic for adults and children. Now, this is a nice weapon against the sun to protect yourself, sunglasses. Now, more than 1.2 million cases of skin cancer are diagnosed in the United States every year. Melanoma, the deadliest form of skin cancer, kills one person every hour. Now, overexposure to the sun is the #1 cause of skin cancer. In fact, one blistering sunburn can double a child's lifetime risk for developing skin cancer. Let's discuss how we can protect ourselves from the sun and prevent this disease. So what does the sun do to the skin? The ultraviolet, also known as UV light, damages the fibers to the skin called elastin and causes the skin to sag, stretch, and lose its ability to go back into place. Now, these are the reasons for the aging appearance of the skin as well. In addition, this damage also increases the risk of skin cancer. Now, what can we do to prevent sun damage? Avoid exposure to the sun between 10 a.m. and 4 p.m. when the sun's rays are the strongest. Wear dark clothing, a wide-brimmed hat, and sunglasses. Apply sunscreen with an SPF of at least 30 with broad spectrum protection. Now, this type of sunscreen protection protects you from both UVA and UVB rays. If you have a sunburn, avoid any more sun exposure and treat the burn immediately. Now, children less than 6 months should not be exposed to the sun. Now, what are some of the symptoms of skin damage from the sun? Early on, we see a change in the pigmentation or color of the skin or wrinkle formation around the eyes, the mouth, and forehead. Also, we can see spider veins of the face or neck or loss of color and fullness in the lips. Later, deepening wrinkles and forehead lines can be seen. Also, the skin can become leathery and precancerous lesions become visible. Finally, skin cancers are found. Now, let's take a look at the story of Jody Beals and how she protects herself from the sun. Please look with me.
My name is Jody Beals, and I have very fair skin. Ever since I was born, I've always had to be careful. Pretty obvious with my red hair, so I really watch out. People make comments, oh, you're always putting on sunscreen, it takes you so long. Do you really have to get every spot? Whoa, you're really making sure you get every spot. Yes, I have to get every spot. That one little spot that I don't get, it will be red. So I know my limits.
That was great. When we come back, we'll meet Jody. Please don't go away.
Sure. Well, my brother was the firstborn and he had brown hair. So when I came and I had red hair, my parents were like, whoa, what do we do? So they asked for advice, and basically the doctor said, you know, lock her in a basement with the lights off, put a hat on, pants, a t-shirt, and sunblock, and make sure it's 50, and she'll be good.
Welcome back. Thank you for staying with us. You know, we now have Jody Beals. Jody, thanks for coming on.
Thanks for having me.
No problem. You know, we'll talk about sun exposure and protecting yourself from that. Tell us a little bit about yourself before we do that.
Sure. Well, my name is Jody, and I work in sales. And I have had sensitive skin ever since I was born with my very red hair.
And then tell me what happened. So I heard a story that the doctors had a little information or advice for your parents about how to protect yourself from the sun.
Sure. Well, my brother was the firstborn and he had brown hair. So when I came and I had red hair, my parents were like, whoa, what do we do? So they asked for advice, and basically the doctor said, you know, lock her in a basement with the lights off, put a hat on, pants, a t-shirt, and sunblock, and make sure it's 50, and she'll be good.
Oh, wow. Great advice. Huh?
Yeah, really good advice.
Oh my God. So what actually did you do during your childhood? How did you protect yourself from the sun? Because you're prone to get damage to sun pretty quickly.
Right, right. Well, my parents always made sure that I had sunblock on. Or when I was little, when I was going to the pool, I'd probably wear like a t-shirt over my bathing suit. And I did actually get some really bad burns when I was little, so now I'm extra careful now.
Now, how'd you get burns? Were you still wearing sun protection? You still got burns?
Well, I think that the main thing with sunscreen is you really have to renew it. And now I've learned you have to put it on about 20 to 30 minutes before you're actually exposed to the sun. Otherwise, it doesn't become effective. And when I was in the pool, the water would, the sunscreen wasn't already absorbed in my skin, so the water would take it right off. Yep.
I mean, you've got to keep reapplying if you're going to be there for hours. Important point that Jody talked about is that, we as a child, you learn a lot from your parents. So the opportunity, whether it be from, food habits or dietary factors, but even protecting yourself from the sun, the time when you can teach your kids what to do is the time when they're young. And her parents taught her, sunscreen all the time, not some of the time for you, and the hat, and try to wear dark clothing if you can, if you're not obviously in the pool or the water. But the key is also what she said, is that apply the sunscreen or sunblock early enough, so 20 to 30 minutes before. But the other thing is reapply it, because people don't realize you have to do it again and again. And when you did that, you're pretty effective. What happened afterwards when you went into more, your adolescent and teenage years?
Sure. Well, now I'm really careful, and when I apply makeup, I make sure that I use foundation that has an SPF of at least 15, which is not very high, but it's on my face, and then I'll also put sunscreen on top of that if I'm going to be in the sun for a while. And I am very, very strict. If anybody put sunscreen on my back, which is a hard area to get to, I'm like, you need to get every single spot, because you'll see a red mark and I'll know you didn't do your job if you don't follow what I say.
So, and always SPF of over 30, right, for you?
I actually try to use SPF 100. I don't know if 50 or 100 makes a difference. I try to use the highest one, and I try to use the baby's ones if possible, because I have very sensitive skin, not just with sun, but different chemicals can irritate my skin, and the baby's one seems to be good. And I also like the spray-on sunscreen, which is the clear one, because it really covers a lot of area, and it's easy to put on, and a little bit faster than the white lotions that you normally use. And
then you're afraid to miss even one spot because you can get burned. And again, important, we talk about SPF 30, but you don't be afraid to go above that, right? And to see if you can get as much protection as you can, because there's no harm in doing that. Did it, when you were young, did it stop you from doing anything that you normally would do? I mean, did it change any of your activities that you would normally do as a youngster, as a teenager?
Sure. Well, I mean, a lot of people get excited, like, yay, it's 90 degrees, we're going to go outside, we're going to get a tan.
You're like, no.
Put on bikinis. I'm like, number one, I don't want to put on a bikini anytime soon. Number two, now I have to put sunscreen on. It's a 20-minute, regimen, and it's kind of annoying. I mean, it is bothersome. You can't just go outside and just lay outside and let that sun soak right into you.
Right.
So, and actually when I was in camp, I just remembered that I got a paper plate award, and it was the sunscreen award. So that's how people looked at me.
For the best habits in sunscreen. That's great.
Right, exactly.
So, important, again, the point she's making is that, despite the fact that you want to, have fun with your friends, it's important to protect yourself. And her parents are the right thing, is that they educated you and they taught you what to do. And you have to do it every single time. And if you don't, and we had a piece of information in the beginning that one blistering sunburn in a child can increase the risk of skin cancer. It can double the risk of skin cancer in a lifetime. Were you ever told that as a child? I mean, to avoid any of this for skin cancer? What did your parents do to actually make you so good about having the protection?
I guess when I was little, I did get a bad burn, probably from not renewing it, and so it really hurt, and it took a while for it to go away. So that was probably the number one thing. And I don't like the appearance of it, so I don't like having that red skin. I want to be as healthy as possible. And now you see on TV and on the news all the time things regarding cancer, and I have great grandparents that had cancer, skin cancer. So I don't want to be a victim of that. And then I also have a sister who has red hair too, so we're both really cautious. Although she doesn't burn like I do. She got really lucky.
Oh, good. So again, we talk about all the factors. She has a family history of skin cancer, And with the protection that you have, I think if we teach our kids, and even without knowing about skin cancer, just the burn itself taught you, but I would say for kids, educate them. We don't give kids enough credit that you'd let them know that this could happen in the future. Whether they listen to you or not, you may think they're not listening to, but it stays inside. And along with your reminder of sunburn, I think it stays. More with Jody when we come back. We have to take a break. Please don't go away.
No matter what kind of skin you have, you need to consult your doctor and make sure that you're following some kind of a regimen. Everyone needs sun protection, maybe not the same as me. Everyone has different types of skin, but you really need to make sure that you're careful and you're taking the right measures so that you don't get skin cancer or any other skin diseases.
Welcome back, and thanks for staying with us. When we left you, we were talking with Jody about protecting yourself from the sun. Let me ask you this, you've done such a nice job over the years. Have you had any sun damage or any issues with your skin in the last few years?
Sure. Well, I do actually have some permanent sun damage because right around this area, it's exposed to the sun a lot when you're wearing a tank top or a V-neck shirt.
Sure.
And just a few slight burns over the years have left some permanent redness that really can't be taken away. Possible laser treatments, a lot of money, a lot of time, and might not even work. So
exactly. So, but except for that, you've been pretty good.
Pretty good.
What's your normal regimen? I think you went into a little bit. What do you normally do now? Not as a kid, but now. What do you do when you go out in the sun?
Sure. Well, always use a foundation with an SPF 15. Yep. And then I always have sunglasses on. I actually, when I was younger, wasn't a big sunglasses person, but now I've become accustomed to using them, and I have to have them on my face always. Even in the winter, I actually wear sunglasses. So all the time I'm wearing sunglasses when I'm outside. And then sunscreen, and I apply it before, especially if I'm going to a beach and there's a lot of sand. I like to put all the sunscreen on before, because otherwise it gets all mixed in with the sand, and it's a big sunscreen disaster.
So and then even the winter you wear sun protection. That's great.
Yes.
And again, one of the big myths about sun protection is that just in the summer and forget the rest of the time, and it's not true. You can get sun damage in the winter as well. And the truth about sunglasses, that's really important. I walked in the beginning with sunglasses as a point that lots of us don't wear sunglasses, and it's good to protect yourself from that. Now, how expensive does it get? We're talking about all this protection. How expensive does it get over time? Is your regimen really expensive because you're really so vigilant, so careful about the sun?
Right. Well, I will tell you that I love the sunblocks that is the spray-on one that's clear.
Yeah.
It's the easiest to put on and takes the least amount of time to put on. But that's very expensive. And one bottle, if I'm going swimming and I'm putting it over my whole body, I could use almost an entire bottle just that time. So it can get really costly, but I feel like it's an expense that I just have to make. It's either that or a really bad alternative.
And what about if you're on a budget? There's some people out there watching who can't maybe afford that. What do you tell them?
Really wear covered up clothing. Then if you're gonna, you can't expose your skin to sun without anything. So if sunblock is too costly for you, then you're going to want to put on a t-shirt and really cover up your skin.
And also, as you said, it's an investment worth making. We were talking about in the beginning how important it is to prevent from skin cancer. You've got to make a choice of what's important in your life. What is the cost of that more important than maybe not having your hair done as much?
Exactly.
You just have to make those choices and say what's important for yourself and be an advocate. Now, what do you feel about spray tans or lotions that darken your skin? What do you think about those?
I am afraid to do any of that. I don't know what the effects would be, but especially tanning. I have a lot of friends that say, oh, I'm just going to go for a short tan at the tanning booth before I go to Florida to just get like a base tan. And I'm like, why are you doing that to yourself? There's so many weird chemicals that are going to your skin. And who said that being tan is like so beautiful? You can have really nice, good skin without it being dark. And well
said. And important, this is really nice to hear, because we are just almost slaves to the media and what people tell us to believe. So healthy skin is this kind of wonderful image that they show us of wonderful tanned individual, and you said you can have beautiful skin without having that, and it may be safer for you. And that's critical. You got to make the decisions for yourself and can't have it, whatever it is, and including, you know, for sun protection. You can't let others tell you, especially the media, that what you're supposed to look like and what's beautiful. And I think more and more people are understanding that and understanding what they need to do to make it best for their health. Now, you've had a lot of experience in your lifetime about sun protection and you know some of the myths and some of the facts. What would you like to tell America that they're watching about sun protection? What would you like to let them know, and what would you like to educate them with?
Sure. I would say that no matter what kind of skin you have, you need to consult your doctor and make sure that you're following some kind of a regimen. Everyone needs sun protection, maybe not the same as me. Everyone has different types of skin, but you really need to make sure that you're careful and you're taking the right measures so that you don't get skin cancer or any other skin diseases. And
also, I mean, even if more or less than skin cancer, the effects of skin on aging. What do you think about that? I mean, you can, you know, the wrinkles that are premature. People talk about beautiful skin, and then if they, you know, they have the beautiful skin, then prematurely they get these deepening wrinkles and skin that ages. So, you know, important, of course. I think that it's important to talk about skin cancer, but also, you know, some of the damaging effects of aging. Lots of people do so much to try to preserve their youth, quote unquote, and then what they're doing is taking, you know, the sun and just damaging their skin to the point where that won't be, you know, that won't be really effective for them.
Like maybe their skin will look good right now, but in 20 years from now, it's going to be a big wrinkled mess, and I don't want that.
That's exactly right. Especially with those of you at home who are watching that have teenagers, you know, this whole going to a tanning booth or just laying out in the sun without protection to get that glowing tan. Tell them that, listen, you know, not in 50 years, we're talking in your 30s and 40s, when and not that long from now, that you're going to look about 10 or 15 years more than what your age is. And that sometimes, although we should talk to them about skin cancer, that may hit home. You know, to talk to them about realistic things. You know, for you as a kid, you remember the sunburn, maybe even more than the skin cancer, so because you remembered that. And if you can telling teenagers who at the time were so self-conscious about their image that this could damage your image would be tremendous. Well, thank you very much for coming on, telling us some valuable tips. I really appreciate it. Please don't go away. When we come back, our favorite dermatologist, Dr. Wendy Sadoff, joins us. Please don't go away. Awesome job.
Well, what we're seeing is the incidence of malignant melanoma, amongst other skin cancers, but the most deadly type of skin cancer, melanoma, increasing by up to 800% in women age 18 to 39.
Back again. This time we're joined by Dr. Wendy Sadoff. Dr. Sadoff, thank you for joining us.
My pleasure.
Appreciate it. We've been talking about sun protection and the importance of it. I mean, what do you think? Why do you think it's so important for us to protect ourselves from the sun? What's the importance?
Well, what we're seeing is the incidence of malignant melanoma, amongst other skin cancers, but the most deadly type of skin cancer, melanoma, increasing by up to 800% in women age 18 to 39. So these young adults with an incidence of melanoma that's increasing, and we're very concerned about that. It's the deadliest form of skin cancer, and we think that it is related to the change in behaviors. In other words, going and having indoor tanning is one factor that we're very concerned about.
As well as, you know, protecting yourself from the sun, obviously. An important factor, you know. So again, we've talked about before, you know, that it's important to have maybe young people even and talk to them about this, the exposure to sun and damaging and the aging process accelerated. But now we're talking about another factor, melanoma, the deadliest cancer, and it seems like the risk is increasing. Are we making any headway though?
We definitely are, and some behaviors have changed. I mentioned the behavior I'm not in favor of, which is indoor tanning. But other behaviors have improved in terms of protecting your skin with sunblock, and the products that we have available to us have improved. So those are good signs.
And the products, meaning the sunscreen you're talking about?
Right, sunblocks.
And how have they improved? Is it the broad spectrum of protection?
Yes, well, there's a lot of misunderstanding about sunblock, and I think it's overwhelming. You go into the drugstore and you see so many products, and the only thing people really gear in, you know, focus in on is SPF, and you have to understand what SPF really means. It's an agreed upon rating for ultraviolet B protection. But the sun doesn't just come down as ultraviolet B rays. There are ultraviolet A rays in the spectrum as well. And those are longer wavelengths of light. Those are responsible for skin cancers and for sun damage and aging of the skin. So the B rays, although they're responsible for that burning, and we certainly want to prevent burning, sunburns, we really have to have a broad spectrum sunblock. And so you can look for number, then you can look for broad spectrum, and then it's even more complicated.
Sure.
Because some sunblocks, even though they're broad spectrum, the A protection may wane with time, so you end up that although the B protection may be a 70, the A is not anywhere near that. And there's not an agreed upon rating for an A.
Oh, that's tricky. So, you know, there's been some advances in the protection, but what you're saying is that it's difficult to discern. Well, the best thing I think would be take it to your dermatologist and maybe show them and see what's going on. I mean, and you would be able to tell, hopefully, because and how can you tell? I mean, can you give us some tips about how people can look, if they can, and maybe figure out for themselves what the best protection from A is?
I think people should come in and they should have a skin exam so that we can look at areas of their body that maybe have developed the signs of chronic sun exposure or overexposure. We should have a discussion about what their sun behaviors are. Do they really want to go out and get a tan, or is it just that they're outside a lot? Are they running during the daytime, and as athletes are getting some sun exposure? And really come up with the proper sun protection regimen. Right. It might be a sport formula. It might be something very lightweight. It might be a spray. It might be a zinc oxide product, which I'm really in favor of. I like zinc oxide.
Zinc oxide, yeah.
Well, zinc oxide is really what we would call kind of a chemical-free type of sunblock. And we're all familiar with the Lifeguard and the white nose years ago.
Yeah.
That's zinc oxide. But of course, back then it was thick and white, and it basically just physically blocked the sun. So it blocks everything. It doesn't block just A or B. It blocks all the rays. And it's great, but it's really thick and difficult. We would call it not so elegant in terms of application. But over time, those products have gotten much, much better. And there are products that are almost clear or invisible that are zinc oxide. So,
and you recommend that?
Yes.
So a good tip that the doctor is saying is that you maybe use zinc oxide and along with getting some sun protection. As a nation, it seems like, you know, we are at least trying to say that this type of protection is important. Do you see that happening in our community and our nation?
Certain areas are better than others. Certainly as a nation, we are behind other nations like Australia, where they have such a high incidence of melanoma, and they have tremendous sun protection programs for their young children. And so we're behind overall as a nation. And there are communities that do better than others. There are some recreational parks that have sun shelters. I think it's kind of mixed, but there's still a lot of misunderstanding about the sun. People will think, you know, if they are not going out to the beach to lay in the sun, they don't need protection. Sun. Right, and we've done studies where we've looked at people who say, I don't get any sun. I'm never in the sun. And of course they are. They're driving and the ultraviolet A is coming through the window.
Right.
They might stop and have a long chat in a parking lot or eat lunch outdoors. They're actually...
It all accumulates, doesn't it?
Yes, and even just that small amount over time really is damaging.
Yeah, so important advice. You know, we heard from our patient previously, or our sun protection patient, you know, came and said, she uses it all the time, even in the winter time. She wears sunglasses, and you're absolutely right. People think that, you know, that just because you're not laying out in the sun that you're not damaging your skin, but you in fact are. And it's interesting how much damage you can get. We have to take a break. More with Dr. Sadoff when we come back. Please don't go away.
You want to have a broad spectrum sunblock. I would not rely at all on any SPF in foundation, in any makeup, or even in moisturizer.
Welcome back, and thanks for staying with us. You know, we have Dr. Sadoff. When we left, we were talking about sun protection and protection from skin cancer, as well as some of the damaging effects of the sun on your skin. Now, let's say you do have some damage to your skin. Is all damage irreversible, or can something be done about that?
There definitely is the ability to reverse some of the damage that's done, and actually our bodies have an innate repair mechanism going on. Just like we have an immune system that fights infections, we also have our system that goes and repairs damaged DNA. So the critical thing is to prevent further damage and allow your system to repair what you have. In addition, there are some topical agents where there is some science that they can repair some DNA damage. So that would be a question for the dermatologist. You know, is something like that appropriate for a patient? And
so if you have any damage, see your dermatologist and understand that, first of all, prevent further damage from happening. Secondly, are there any topical lotions that you can use? So great advice. How often should we, you know, for those of you watching at home, how often should we examine our skin for signs of damage?
I would say a general rule is once a month.
Okay.
It's an interval that people can remember. They do other things every month. They can just link this to that, and they're more likely to do that. And then once a year to see your dermatologist. And after that, as you know, depending upon what damage is there or what the risk factors are for skin cancer, you know, just determine an interval for going into the doctor. But at home, once a month.
Perfect. And if you're somebody who's single, you know, if you're married or have somebody significant with you, you know, it's easier to watch your back. How do you, if a single person, how do you recommend they examine themselves? I mean, do you have any tricks?
That's a great question. Good reason to meet someone, right?
In order to get an exam, please find someone.
Cut that part. There is a card that I actually have in the office that shows how, with a mirror, one handheld mirror and then like the other mirror in the bathroom, how you can really see the back of your thigh, you know, all these areas that are tougher to see. So there are very few areas that will be missed. Then there are areas, though, that are difficult in terms of like your scalp. That would be difficult for someone. But I always say, wherever you are that someone's looking at that part, whether you're at the hairstylist or you're having a massage,
That's a great point.
Someone's looking at an area that you may not be able to see regularly.
And ask them.
Ask them, tell them you're comfortable with them letting you know if they see anything.
That's a great tip. You know, sometimes you don't look at certain areas that much, and if you have somebody who sees you regularly, ask them, has anything changed? That's an important tip. Now, Jody, you know, who was here before, she had a great regimen, and she was using SPF 100. I mean, first of all, tell us about her regimen. Does everybody have to follow her regimen?
No, not everyone, and the SPF 100 can be a little tricky. Again, there may be a great product that's an SPF 100, but SPF, like I said, is a limited piece of information.
With the UVB protection you're talking about.
Right. You want to have a broad spectrum sunblock. I would not rely at all on any SPF in foundation, in any makeup, or even in moisturizer. So when people say, well, it's a 15 or it's a 30 in my makeup, I would disregard that as if that doesn't even count. That's usually, you're not applying your makeup thick enough to get that kind of protection.
I see.
And it's usually not a broad spectrum.
Even foundation? Foundation,
we don't apply it thick enough to get that kind of protection.
I know a lot about foundation after this show.
Maybe your foundation.
Maybe mine.
But so I, in general, don't assume that you're getting anything significant at all with foundation, but she is also using sunblock on top of that. There's one other thing she said that I just want to comment on. I think she's amazing, and she's so aware of every area to protect, and she's been doing it from a young age and using protective clothing and
sunglasses, all of it.
Perfect. The sprays, some of the sprays you have to be careful about because they really, in order to get the protection that is intended, it's a spray rub like 3 times in order to really get that level of protection.
The spray sunscreen you're talking about. Okay.
With the exception of a zinc oxide spray that's newly out, and that's a different story, and that's a great product.
And what about her contention that it's, I'm sorry to interrupt you, but that it's faster? She doesn't like the 20 minutes, I mean, as much, obviously, but I mean, is it faster?
I think that sunblock has to be practical, and speed of application is key. So I do like the zinc oxide aerosol spray. But the others, maybe have them as an additive, not just the only sunblock that you're using on your body. Maybe something for reapplication because it's quick and you're there and it's cooling when you put it on. But in general, if you're doing a spray, it would be added to another sunblock or the zinc oxide aerosol.
And is that available, I mean, anywhere, the zinc oxide spray?
The one that's out now is only available through dermatologists.
Okay.
But there may be some additional products coming out as well.
Pretty expensive or no?
It's interesting because you did mention expense to her,
Yeah.
and you don't need to spend a lot. As a matter of fact, I wouldn't go to the department store to buy your sunblock at all. And at the drugstore, they're about $15, $15 to $20, and sometimes at a dermatologist might be $20, $25, so not that much different. And you don't need to spend a whole lot, but it is a decision to invest in a good sunblock.
And the zinc oxide, you said about 20, is that what you said, or how much?
It can be about 20, 25, some of them,
And
but
how-
not too much different than the drugstore price point.
For a lot of us who are at home, I mean, how long would that last, the $20? I mean, will it last a month or 2 weeks? Or?
Well, if it's just a product for your face, it's going to last over a month.
Okay.
If it's a product for your entire body and you're out all day, you know, it's going to go more quickly. And she mentioned reapplication being key, so is the amount that you put on. And the reason why I don't like a product that's too expensive is I don't like someone to be, you know,
Skimpy on
really
it.
skimping, thinking that they don't want to
It's
go
too
through
expensive.
it. So I think
Great tips.
yeah.
Great tips. I appreciate it. We have to take a break. When we come back, we'll take some questions from our studio audience. Dr. Sadoff and I will answer them. Please don't go away. Thank you.
So it's not where we used to think we buy our bottle and we have it all
You're done.
summer long.
Right.
No, you have a basket of all different types of sunblock for different purposes.
Nice to have you back again. Now it's time to answer some questions from our studio audience. Dr. Sadoff, are you ready?
I'm ready.
All right, let's do it. Yes, sir.
Hi.
Hi.
As African American, is sunscreen with a rating of SPF 30 adequate enough for me?
It's a great question. You know, dark-skinned people like myself too, I'm Indian, you know, and number one is that SPF 30 adequate? And also is sun protection as important, you know, add to his question, is sun protection as important for me and an African American as well? Is that a big deal for us, or should we just leave it alone because we have natural protection?
Well, you are less likely to burn. That's one thing. But I would say that wearing sunblock on a regular basis is important. You may not be as likely to burn, but another factor in terms of the sun exposure is the blotchiness that can arise. And that's a very difficult thing to treat. So you don't want to have dark spots and irregular coloration on your skin. And I would say, yes, even in darker skinned individuals, still wear sunblock and examine your skin. There are some skin cancers that are more likely in darker skinned individuals, a type of melanoma that's more likely to be found on fingers, toes, ears, nose, those places. So skin exams, self-check, and sunblock still important.
And the question that I added on was, you know, meant to show that some people feel that, you know, and that I'm dark skinned, I don't really need any protection. In fact, you do, like you talked about the melanoma, and we still are prone to get sun damage, and so it's deceptive what could happen. So yes, sun protection is as important for us as well, you know, and there are many people watching who are, you know, the same skin color as myself or the gentleman who asked the question. So great question. Yes, next question.
I've heard that applying too little sunscreen can be worse than applying none at all. Is this true?
Well, that's a great point. You know, we talked about before that you should apply adequate amounts of sunscreen. Now, what she's asking is, can it be worse than not applying any at all?
I would say no. I'd rather you apply a good amount in order to get the full protection. But for a given amount of exposure, in other words, for a given amount of time, any amount of sunblock is better than no sunblock at all. So it would be like, is protecting with a short sleeve shirt not as good as protecting with long sleeves? Yes, but it's better than protecting with no sleeves. So it's, you know, anything is better, but what we want to make sure that a person's not doing is that they have a little bit of sunblock and then they're staying out longer than they should or whatever. But
there's a myth about this, though, isn't there? That if you put a little bit of sunblock, can there be production of some damaging free radicals or anything in the? Is that just the old wives' tale then?
well, I think there are a lot of things raised, like, is sunblock dangerous at all? And I would say certainly not dangerous like the sun's rays are, and I think there is abundant evidence that sunblocks are safe. But if there is concern over some chemicals in sunblock, the zinc oxide eliminates that concern.
Well, that's a great tip. So first of all, there's no convincing evidence that this too little sunscreen actually does anything. But in fact, if you're concerned about that, I mean, that's a great tip that zinc oxide actually does it. And the spray is fine. And in addition,
the zinc oxide spray, I like that. And then, of course, all the other ways of protecting your skin with the clothing and the hat and sunglasses and shade.
And we can't forget about that. Now, are there any other forms of zinc oxide that you like, or just the spray?
No, I like the spray, the creams, the gel. I like it all.
Oh, and which is the easiest? Is the spray is easiest to get?
Spray is easiest, fastest for the whole body, but it's not going to be, you can't use it on your face. So that brings up that you really need a collection of sunscreens or sunblocks. You might need something certainly for the lips in a stick formulation. You're going to need a spray maybe for the body. You're going to need a sport formula. So it's not where we used to think we buy our bottle and we have it all summer long.
Right.
No, you have a basket of all different types of sunblock for different purposes.
And if someone's on a budget, and as quickly as you can, because we don't have a lot of time, I mean, what should they do about the zinc oxide? I mean, they need different formulations. If you had to pick one form, would it be the spray?
I think the spray would be great, or you can go to the drugstore, look at percentages of zinc oxide and, feel the formulations, but a lot of it is that you have to find a product that you'll use. So even the best, most protective product isn't going to work if you really hate the feel of it.
And if you don't use it. That's a great point. Next question. Yes, sir.
Yes, are there tanning beds that are safer than being out in the sun?
I think that, the short answer is probably going to be no, but I'll ask Dr. Sadoff, what do you think? Are there any safe tanning beds out there?
None.
Yeah.
As a matter of fact, there should be certainly
a law against them.
I'm pretty passionate about restrictions in terms of tanning beds, and in terms of younger individuals, but it is not safer. It can be more dangerous because people have this false sense that
of security.
It's indoors. They're getting the rays indoors, but they are getting an intense dose of ultraviolet radiation on their skin, and oftentimes not protecting areas well, like their eyes or other areas.
We have to take a break. When we come back, more with Dr. Sadoff, and we'll both answer your questions. Thank you very much.
Do spray tans have any dangers, and how often can someone get a spray tan?
Thanks for coming back. When we left you, we were answering some questions rather from the studio audience. And are you ready, Wendy?
I'm ready.
Perfect.
Hi.
Yes, hi.
Do spray tans have any dangers, and how often can someone get a spray tan?
Well, that's a great question. With all of the dangers that we have of tanning boots and tanning beds, spray tans, what do you think about that?
Well, I would much rather you go get a spray tan than try to achieve that bronzed look by going out in the sun or going to the tanning booth, as we talked about earlier. That being said, that is a chemical being sprayed on your skin, abbreviated DHA. It's a chemical that the FDA has said is safe, but there are some precautions I would advise taking.
Sure.
I would say I wouldn't want you to inhale it or have it near the eyes, nose, or mouth, because it's really just to attach to the most outer layer of the skin and then cause darkening. So I'd much rather prefer that, but in terms of how often and how you do it, there's a larger percentage of that chemical, DHA, in the modern spray tan than there is in the lotions that you would use at home. So if you are concerned about the chemical, and some studies that were done, these are animal studies, then you would use the lotions with a lower strength. And also, then it's not aerosolized. It's not in the air to inhale it or get it near the eyes or nose. So.
But tell them about the dangers. I'm sorry to interrupt you, but tell them about the dangers of why you're worried about the eyes or the nose. Tell me.
Well, there's more absorption. Okay. So if we don't understand all that may be
you don't want that to go in your body.
Exactly. So keep it just on top of the skin. It attaches to the outermost layer, and use the lotions maybe more than the modern spray tan store or spray tan.
Sure. Absolutely.
Salon, and also maybe mix it up with bronzers or other ways to kind of keep that look.
Perfect. And so great advice. The bottom line is better than going to a tanning bed, but still could have some dangers. We don't know a lot about this, unfortunately, because we're just learning more about it. So great advice. That's, if you need to maybe use lotions instead of the spray tans that we talked about, and enhancers. So great point. Yes, hi.
Hi, doctors. I have to watch my vitamin D levels, and I'm concerned that if I apply too much sunscreen, I might minimize the absorption of vitamin D from the sun. Is there a concern about that?
That's a great point, because we need vitamin D. It's an essential vitamin. And what happens when you put the sunscreen? Does it change? Because you need some ultraviolet radiation to actually convert the vitamin D to a form that you need in your body. So how do you reconcile that? On one hand, you want the vitamin D, you know, because you need it as a nutrition. On the other hand, you want to protect yourself from skin cancer. This is kind of a problem.
Well, there's no proof really that use of sunblock results in lower vitamin D levels. And if you look at people in regular urban populations that are not near the equator, there's a huge percentage of us that are vitamin D deficient.
Sure.
And I don't advise going out in the sun and exposing yourself to a known human carcinogen to get that vitamin D. So vitamin D is easily measured in the blood. Find out first whether you're deficient or not, and then it's something that you can take safely by mouth as a supplement. So I often will tell my patients who really think they need to get a lot of sun to get some vitamin D activation, I kind of analogize. I say, if there was something really good in cigarette smoke, that we found one good thing in cigarette smoke,
point. Would you smoke?
We wouldn't say, you know what, just take 2 cigarettes a day.
Yeah.
Get that we would isolate that good chemical and supplement with it. So again, we wouldn't expose ourselves to a carcinogen to get one valuable
That's
chemical.
a wonderful analogy, and the idea is that absolutely you wouldn't try to have a carcinogen to try to get a potential good effect. And the key is that there's different types of vitamin D, and we've talked about this in other shows. Vitamin D3 is the one that your body can convert and make available in the skin, and you can get that from fatty fishes. You can eat a little bit more salmon, maybe. You can eat other fatty fishes and try to make up for that. We have other ways of getting vitamin D, so there may be a concern, but if you have an alternative, why risk skin cancer? I mean, I think the dermatologic societies have been pretty clear in making their position and saying that try to really avoid any unprotected sun exposure because of vitamin D. So it's a great question, because that's an important topic. Yes, you have a question?
Hi. Are there any medicines that can make the damage from the sun worse?
Well, that's a great question. So how about potentiating the sun's damage? So even accelerating it. Are there medicines that she has to worry about?
Yes, and many that I use in my patient population. So I use a group of medication, the tetracycline group of antibiotics for acne, and those can be some of them more than others, but some can be very sun sensitizing. So there are ways to get around that. First of all, you make sure the person has good sun avoidance behaviors. But in addition, if it's a daily medication, oftentimes you can take it more towards the evening so that it peaks in your bloodstream when you're not out in the sun. It'll peak during the night, as opposed to taking it in the morning when most people are used to taking medications and having it peak right during those peak ultraviolet exposure times.
The 10 a.m. to 4 p.m.
Exactly.
Perfect. And and so if you get educated and understand what medicines can harm you, you can work around it. Now, what happens if you're somebody who is working outside? What do? You just cover yourself up as much as possible, right?
We have a lot of patients who work outdoors, and I think it's important to know what exactly their work is, because it may be that a certain type of hat is more practical than another, or they can maybe cover up more, or they can break it up during the day. So the more you have a conversation with the dermatologist about what your occupation involves, and also what your recreational hobbies involve,
it can help you.
You can figure out a way to minimize your damage.
Perfect. Thank you for taking the time, Dr. Sadoff, for answering all those questions. I really appreciate it.
My pleasure.
When we come back, Partha's Prescriptions. Please don't go away. Welcome back, and thanks for staying with us. Now today we've been talking about sun safety. What can we take away on today's Partha's Prescriptions? Number 1, be proactive. Protect yourself from the sun to prevent damaging and dangerous effects in the future, including skin cancer. Number 2, avoid the sun between 10 a.m. and 4 p.m. when the sun's rays are strongest. Number 3, when out in the sun, wear sunglasses, dark clothing, and a wide-brimmed hat. Number 4, when using sunscreen, use one with broad spectrum protection with an SPF of at least 30. For more information on sun safety, please visit our website at www.askdrnandy.com. Also, you can join the discussion on our Facebook and Twitter pages. Just ask Dr. Nandy. Lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. Thank you for watching and see you next time.